Emily, thank you. Thank you. We're going to get right into these questions here. Can you share how integrating speech pathology services into integrated care models contribute to a more holistic approach to patient care?
Yes, of course. I right now work with children and I work usually with the early intervention.
Hmm.
And I can definitely say from experience that children with the delayed communication development may get frustrated and exhibit these challenging behaviors to
Okay.
compensate for their delays. And in my case, I'm usually the first one on the team,
Okay.
um, because I work in these schools where they're usually 0 to 5 years old. So a teacher will see that a child is falling behind in the classroom,
Mm-hmm.
let their parents know. The parents will contact me. I will
Hmm.
evaluate the child and I will actually make the recommendations moving forward. And we will offer all services following through speech, OT, and counseling for the teachers as well.
Hmm. Good. Okay. Good deal. Because I'm imagining of the percentage and amount of patients that come into these settings that particularly have these particular challenges and the impact that it has on them just holistically in healthcare. So,
Most definitely.
mhm, mhm. Uh, what is the impact of speech pathology on improved health outcomes for patients?
Well, again, I work with a very small percentage, which is
Mhm.
early intervention.
Okay.
But our licensing, we can work from everything to swallowing, fluency, voice disorders, traumatic brain injury, dementia, autism, articulation, stuttering. It's such a large array.
Mhm.
So specifically for my fields, the early intervention is we want to find out why this child is falling behind, where this child is
Mhm.
supposed to be at, and how can we
Mhm.
help that child get to where they're supposed to be at.
Mhm.
However, I have had experience in hospital settings. I have had experience with adults who have had strokes, they've unfortunately were completely fine and on a regular Sunday just had a stroke and now they're aphasic and they're not able to communicate at all with their loved ones. And that's why I'm in this program because I want to know
Mhm.
how I can better serve the mental health aspect.
Okay. Good deal. Good deal. So, speech pathology, we would say that has impact on health outcomes, period,
Overall,
overall.
whether it's the parents, whether it's
Mhm.
the child from zero
Mhm.
to death really is
Mhm.
our what our licensee falls under. I just happen to have experience with a large array of settings and ages, and
Mhm.
I just happen to
Mhm.
fall in love with early intervention.
Early intervention.
Yeah.
Great. That is great. What are the preventative aspects of speech pathology and how early intervention can mitigate the development of more severe health issues?
Well, so again, usually I'm the first one on the team,
Mhm.
and usually if a child is falling behind again with communication, you're
Mhm.
going to see tantrums. You're going to see um, what I see now is actually such physical behavior in classrooms. And I'm talking about 2 year olds that are spitting and scratching each other. And
Mhm.
this is simply because they probably wanted their water bottle and they don't know how to communicate that, whether
Mhm.
it's through a sign or just through one word. Again,
Mhm.
remember 1 year old, one word. If your child is 1 years old, they should be saying at least one word. And that's something that is so important to remember early
Mhm.
intervention. Um, so if a child can learn how to use language to convey these messages, they're going to
Mhm.
be able to express and interact, whether it's with their parents, with their classmates. And again, children with delayed communications, they're going to get frustrated and they're going to exhibit that through any sort of negative behavior, any sort of behavior that's
Mhm.
going to cause attention.
Mhm.
So this is why it's so important to catch this early on, because that behavior is only going to get worse. And they're only going to continue to fall behind.
Okay. Absolutely. And I know as a clinician myself that these are some of the, when we're doing a comprehensive assessment, that we can sometimes see where the onset of these challenges in that age group was like an onset of
Mm-hmm.
further behaviors uh,
Mm-hmm.
as the child, grows and develops in the stages of the development. So I definitely agree with you. Can you provide a highlight on how integrating speech pathology aligns with the care model?
Yeah, so
Mhm.
I was taught by this one professor that I'll never forget to
Okay.
focus on the family and family centered,
Hmm.
especially with the field that I'm in with early intervention.
Hmm.
Because yes, we want to focus on the child getting better and the child getting to their norms. However, the family is the one right now making the decisions for that child.
Hmm.
We're talking about a 1-year-old or a 2-year-old. They they start to become more aware that they're falling behind, I believe, when they're 3 to 4.
Hmm.
That's when they start to exhibit those more violent behaviors towards adults now. It goes from their classmates to adults.
Hmm.
So I usually focus on the parents, having these parents become aware of the fact that their child is behind.
Hmm. Right.
Sometimes is a
Hmm.
huge one. When I make these recommendations, having them understand why I had to make these recommendations. Usually the behavior therapy or the behavior evaluation is a tough one for them to accept.
Hmm.
And I have to make these recommendations because I see this child in the classroom and they're all their friends are in a circle doing circle time, and they're the one child playing with a car going back and forth, back and
Hmm.
forth.
Hmm.
And the parents are not there at the school watching the child through a camera the whole time or through a window the
Correct.
entire time.
Right.
So I focus again on having these parents come to the reality of this is where your child is at, this is where your child needs to be, this is why these recommendations are so important.
Hmm.
And sometimes I have to just throw the towel and just offer my speech pathology because that is what I'm licensed to do.
Right.
And when they come to me 6 months later, when I reevaluate and it's why has the whole social aspect not increased?
Hmm.
I'm like, so
Hmm.
remember 6 months ago when I made that recommendation? Did
Hmm.
you did you go to that? No.
Hmm.
Oh, okay. So 6 months, I can reevaluate. Here's my recommendation again. Go to behavior.
Okay.
So
Good deal.
again, DBH, this is why I'm
All
here.
right. That's why you're here, blazing
Hmm.
that path of DBH path speech pathologist. Okay.
Yeah.
What is the importance of collaborating with collaborative care teams that include speech pathologists working alongside with other healthcare professionals?
So right now I work alongside with the behavior team,
Hmm.
usually the RBT and the analyst. Uh,
Hmm.
Occupational therapist is part of
Hmm.
our own company,
Hmm.
and we offer the speech therapy, obviously.
Hmm.
And the way that we work, which I have found very helpful, I actually offered this idea to my boss, and so we have this application called WhatsApp, and
Okay.
it's international. So it's the best thing
Hmm.
because we work in Miami, specifically in Doral, and most of our patients are Colombian, Venezuelan, and just
Oh.
and Argentinian. So they're not usually from here. We actually get a lot of patients that just come in from other sideline. Anyway, So we
Mhm.
use these applications to create these chats where on these chats we have our occupational therapist, the behavior team,
Mhm.
parents, including mom and dad,
Okay.
myself, and our company owner. And we use these chats to every single session, we send at least a picture, at least a clip, some sort of video clip, because
Mhm.
I feel like I can tell a parent, oh yeah, tell them to do this
Hmm.
and send steps. But I mean, it's so much easier if I just send them a video clip of what I'm doing in our session.
Hmm.
So how to see how that can help.
Okay.
Our occupational therapist does the same thing. So when I'm working on a skill that may have a challenge for occupational therapy, I'm like, okay, let me go back to that clip.
Okay.
Our behavior therapist also
Mhm.
shares clips on there, and it's been so helpful, not just for the parents, but for the therapists themselves. And also if any therapist notices a concern in regards to speech, they let me know, usually on there. Same thing, if I notice anything in regards to occupational, I let them know on there. And it's been extremely helpful also for our evaluations, which is usually every 6 months, because I go back to these chats. I go back to these messages that share these issues and these concerns, and ta-da, these are the things that we have to focus
Right.
on to get this child to their norm.
Great. 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 How does communication play a role in mental health? And how can speech pathology address communication challenges that may impact mental well-being?
Well, again, with children, usually decreased communication skills will usually reflect in increased frustration, increased negative behaviors such
Mhm.
as lashing out, being violent towards their parents, being violent towards classmates. And from my experience with adults, usually the loss of speech at such an traumatic experience as a stroke, from being completely normal one day and speaking, communicating with loved ones, to just losing all aspect of communication the next.
Mhm.
I can only imagine the just large frustration and depression of not being able to express yourself, not being able to understand what's being said to you, from being completely okay one day to being almost a vegetative state the next.
Wow.
I cannot imagine that. I have had very little experience with that, and it was such a sad experience for me because I had this one patient that it actually happened to him on Valentine's Day, and that's coming up now. He had a stroke on Valentine's Day. He's an artist here in Miami, and he can receptively, he was fine. He can understand everything, but expressively, um, he would get his words jumbled up, and the frustration that that man was expressing just from just the smashing on the table and the crying and the grunting, until I finally said, oh yes, the Frost Museum. He was so excited because finally somebody understood him.
Wow.
Um, and I, again, don't have much experience with the adults,
Mhm.
but I would love to have more experience and learn more, hopefully, through this program.
Mhm.
But from what I have had experience with um, children, again,
Mhm.
the amount of children that I have to refer to behavior therapy
Mhm.
lately, because and it's crazy because they will go to a neurologist, they will go to a psychologist and not have a diagnosis of anything. The parents need better guidance. And usually now these parents are having COVID babies. So it's the lack of social being around other children at that early age. I would also love to do some more experimentation on the mental well-being of these COVID children.
Wow.
That's something that I really want to focus on perhaps for my end project. Because it's
Right.
something that I'm noticing now. I go back and I look at the
Mhm.
age that they were born, and it's like 2020, 2021, and it's like,
Right.
oh, so you are just now around other children. You are just now having to communicate because
Mhm.
you were at home until now, having everything being done for you,
Right.
everything being handed to you. So that's the sad reality of the mental well-being of not just our adults, that is declining daily, but our children as well since
Absolutely.
COVID.
Yes, COVID. Absolutely. Glad that you pointed that out there. Can you share with us how mind-body connection and how improvements in communication can positively influence mental and emotional well-being?
Again, I feel like I really went on about this with our last question. It's
Hmm.
these children and their not being able to communicate, the tantrums, the you go to the stores now and you're like, what's wrong with that kid? Why is he screaming? Why is he crying like that? Control your child. Probably that child can express, Mom, I'm tired. Mom, I want to go home. Mom, I'm hungry. Mom, I'm thirsty. So their way is just screaming and crying and having a tantrum. How can we control these tantrums? And the overall emotional well-being of these kids. And I mean, I can't imagine having a tantrum every 5 minutes. I would be exhausted by the end of the day.
Right.
That's why these
Right.
kids hit the bed and they are out. And again, um, for our parents, the importance of the early intervention and having all these services offered early on and all these delays um, diagnosed early on.
Yes, right. And that's very stressful to have these type of challenges. And the thing I wanted to point out, one thing I've learned from you as I'm connecting the importance of speech pathologists in integrated care, um, that as far as the mental anguish that comes along with some of these challenges, uh, what a lot of people don't know, that the things that we experienced in our childhood have a lasting impact on our health as adults. And I was recently reading a study uh, and found like a compelling link between childhood stress and a higher risk of developing conditions like high blood pressure and obesity and diabetes later in life. So this early intervention of speech pathology in connecting with mental health and in the medical setting is very important, very important. So thank you for continuing to being in this effort.
No,
Um,
most definitely. And
mhm,
again, if these
mhm,
behaviors don't get addressed early on, they're just going to become more and more challenging. Because
mm,
from what I have seen personally, when they're 1 to 2, they sort of lash out to their classmates because they don't know how to play. They don't
mhm,
know how to ask a friend for a toy. So they will hit a friend, they will scratch a friend. But as they get older, they're not able to communicate overall. They're not able to control their emotions, not just with their classmates, but in general. So they will, I get kicked. I've gotten kicked by a 5-year-old that to
mhm,
this day, the parents will not understand that your child needs
mhm,
perhaps mental guidance, mental counseling, a psychologist. He needs some sort of, maybe he
mhm,
doesn't need an RBT. Maybe there's not actually a diagnosis of autism. Everyone is afraid of getting the
mm,
autism diagnosis.
mhm.
Um, there's a lot of defiancy. There's a lot of just, I don't want to do my homework
Right,
because I said no, I don't want to. When we need to start addressing this early on so we don't get to that.
right, right.
So,
That early intervention would definitely have an impact on the healthcare system in general.
mhm.
Definitely decrease the costs that are associated with our overloaded healthcare system. So again, very important to have speech pathologists. Um, especially DBHs, on the front lines of this whole entire movement here. How does speech pathology contribute to inclusive mental health care? And we spoke about that piece, but particularly I'm targeting for individuals from diverse linguistic and cultural backgrounds.
From my personal experience,
Mhm.
I'm now getting a lot of patients from Asia and more specifically China. And um, I have, I want to say 4 cases right now that
Mhm.
are American Chinese
Mhm.
who are on the autism spectrum.
Okay.
And although they are receiving my services for speech, and I'm working on them becoming within normal limits for expressive and receptive and articulation, I'm noticing that I'm focusing a lot more on training parents
Mhm.
on the social aspects of autism.
Mhm.
So something that's very large that we focus on as speech pathologists is autism and
Mhm.
social behavior, which a lot of teachers actually don't notice. I will go into a classroom and I like to just sit and watch my patients along their classmates, and I will notice another child that's sort of falling behind socially, and
Mhm.
I'll bring this
Mhm.
up to a teacher and they'll be like, "Oh yeah, but you're just a speech therapist." And I'm like,
Mhm.
but we don't just do speech and
Mm.
language. Under language
Mhm.
is this that we're doing right now. We're having a
Mhm.
conversation. It's the
Mhm.
social aspects. So it's like so many people don't notice how being socially awkward is that needs to be worked on early on as well. So I've noticed that with these parents that I have that are Asian American, oh, why isn't my child saying I love you back? When I say I love you, they just say okay and walk away. And I have to say, I'm sorry, and I cannot imagine how that feels emotionally, not being able to hear your child say it back. But again, let's remember that your child has autism, and being autistic, they have these social barriers. So I have to do a lot of training for different cultural backgrounds, not just American because we are in America, because
Mhm.
I also now have a lot of Chinese patients. I have a
Oh,
lot of
wow.
Colombian patients. I
Okay.
have a lot of Venezuelan patients. I have a lot of Puerto Rican. All of Latin America, you can imagine, because we are in Miami.
Mhm.
Um, and it's breaking these norms, especially for the Hispanic male of your child needs a therapist. It's breaking the norm for a Chinese American parent that your child is autistic.
Mhm.
That's my personal experience with different cultural backgrounds.
Wow. And you definitely have experience right there. Definitely. And our final question for you. Can you explain how your education that you're receiving through the DBH program at CGI is preparing you to strengthen and further promote the efforts of speech pathologists in the integrated healthcare setting?
So my goal when I finish this program
Hmm.
is to hopefully move more south. I'm currently in Miami, Florida.
Okay.
However, I was raised between Miami and Florida Keys. The
Okay.
Florida Keys has absolutely no services.
Oh, okay.
We have, I believe, 2 hospitals, and in those 2 hospitals, we have one psychologist and one speech pathologist
My,
for the entire Florida Keys.
wow.
So I have noticed that we are popping up with more schools, with more housing. I have seen 1 or 2 behavior clinics open up, but
Hmm.
again, nothing offering occupational therapy, speech therapy, counseling, which is very needed down there. We have a lot of veterans, we have a lot of older adults, we have a lot of um, um, children because we have so many schools there, and the schools there are huge. So the schools there are also K through 12. So it is a dream for any therapist to just land in one of these schools and just offer services to every child at that school and then place another therapist at another school. Why is nobody doing this? This is what I want to be able to offer. I don't know yet, honestly, if I want to be able to have some sort of clinic where we can offer services for children through adults.
Mm-hmm.
That will include mental health counseling, since that is something that I will gain through DBH.
Mm-hmm.
I want to be able to offer speech, occupational therapy, perhaps physical therapy if our center is large enough. I don't know if I want to have a center yet, or
Mm-hmm.
if I want to offer services where I can go to a patient's home, because that is something that I
Mm-hmm.
also did and experienced during COVID. And it was extremely comfortable for parents, and I can only imagine that for an adult would be even more comfortable if they could just have their clinician come to their home. I just know that I want to be able to extend my services south where it's needed.
Okay.
And I want to be able to offer everything that I have right now, which is my experience in speech, but
Mm-hmm.
I also want to be able to offer more guidance, specifically through mental health,
Mm-hmm.
um, through what I love, which is
Mm-hmm.
early intervention. And if I can bring someone on my team that feels more focused and strong in working with veterans, which is something that's very strong, and it's a very large community down there. We have a naval base.
Wow.
We have one psychologist, just so you can
Wow.
imagine. Um, so yes, DBH, that is what I need to be able to offer these services.
Well, I tell you what, I definitely uh, see you making that impact and change. You're definitely one of our star scholars in the program, and I'm just excited about what impact you're going to have in the integrated healthcare field in a specific scope. And I thank you for taking the time today to talk to me and our audience um, about the DBH pathologist. You know, it's amazing just to get your perspective. I mean, you're boots on the ground, and you're developing these skill sets, combining your education you're receiving in the program, and the entrepreneurial spirit, and creating and being innovative. And I look forward to seeing all the wonderful things that you're going to do to make this impact and change that I know that's going to have a lasting impact in improving health outcomes to all these populations out here. So thank you
Well,
for
I
taking the
thank
time.
you. I
Mhm,
thank you for your kind words. I thank you
mhm,
for the time to be able to share something that I'm so passionate about, which is
mhm,
my field, speech pathology, early
mhm,
intervention.
mhm,
I hope that this word gets around, and
mhm,
we have a lot of parents in our program, in our
mhm,
school.
mhm,
If they have small ones, remember the importance of the social, remember the importance of our teachers. Our teachers
mhm,
see everything. Listen to the teachers, what they have to say about your kids.
mhm,
Um, and I thank you for accepting me into this program, and I am
mhm.
excited to see what happens and
Absolutely.
going south. So
Going
get
south.
ready, Florida Keys.
All right, Florida Keys, look out. Here she come. Again, thank you, and thank you to our audience for taking the time to listen today. So please like, share, and subscribe to this podcast. And we hope that this conversation in this particular podcast has enlightened you on the importance of the DBH speech pathologist in integrated healthcare. And Emily is definitely one to watch, so keep your eyes on her.
Thank
Okay.
you.
And we say to everyone, please join us in our next podcast.